I'm Eric, your host here in New York, and I'm thrilled to welcome the esteemed Dr. Abrar Umar, a renowned public health expert, certified cognitive behavioral therapist, and celebrated motivational speaker all the way from Islamabad, Pakistan. Dr. Umar, I'm eager to hear your insights on the complex and ethically charged topic of surrogacy. Please share your perspective with us.
That's great. Thank you, Eric. Before I delve into this important topic, I would the details of the topic and the perspective of Islam. Being a practicing Muslim, I would speak in the perspective of Islam and holy books and divine books before I delve into the philosophy and doctrine of Western paradigm. So I always believe that there are two paradigms of living life. One is the Islamic paradigm, which is very much divine one, and the second is Western paradigm that believes that with the passage of time and with the evolving psychology of human beings, anthropological changes and cultural newness, we would change the laws, we would change the ethical doctrines, we would change the definition of fair and unfair. So while belonging to Islamic paradigm, I am very strict that I would see the things through the lens of Islam, and my perspective would solely be based on Islamic principles and orders. First of all, I would define Islamic paradigm as the order of Allah. We believe in order of Allah and practices of Holy Prophet, and we cannot deviate and rebel and violate the laws of Allah which were given to us almost 1500 years back. So Western paradigm is something they believe in change, they believe in newness, they believe in evolution. We do believe in evolution, but not at the cost of our spiritual values. That surrogate mother is a woman who harbors pregnancy and who rents out her uterus for upbringing a child, or nourishing a child rather, not upbringing, for a couple. And surrogacy has two types. One is the traditional surrogacy, where mother is the biological, surrogate mother is the biological mother of the child. She contributes her egg to the constitution of the child, but sperm is coming from the intended father. So the mother who is going to upbring this child, who has planned, who is intended mother, she does not contribute to the constitution of the baby. Second type of surrogacy is gestational surrogacy, and that is that sperm and egg, they are fertilized outside, in vitro fertilization, and an embryo is planted or put in the womb or the uterus of surrogate mother. This is known as gestational surrogacy. Both type of surrogacies are strictly forbidden in Islam, and Islam believes that egg must belongs to, and Islam believes that egg must belong to the actual mother, who is intended mother as well, and the sperm must be from the male, who is the real husband of that very woman. So Islam believes that due to lineage and inheritance issues, the real mother and father should be involved in production of a child, and that couple should be legally bound to each other in a religious way. That bond should be religious, and then there are implications of this pregnancy and everything. And if they cannot produce a child, there is some shortcoming, there is a problem, then they can have a test tube baby if they are having sperm and eggs intact. Embryo is put or planted into the womb or uterus of the same mother, who is intended mother and real mother as well, because she's contributing egg and the father is contributing sperm to the would be baby, would be child. So this is the philosophy of Islam, and surrogacy in any case, in any type, is forbidden in Islam. Can you go for any other question?
I see your unwavering stance against surrogacy is firmly rooted in the tenets of Islam and the sanctity of the family unit. I'm intrigued to delve deeper into your perspective on the religious and ethical implications you've outlined. Could you expand further on the specific Quranic teachings or hadith that inform your position on this contentious issue?
Yes, you can talk about lineage and inheritance and the ethical issues, psychological issues, and legitimacy. In fact, what is the most important thing is the doctrine of Islam. Islam believes in order of Allah. We don't go for our benefits, our cleverness, our innovation regarding Allah's orders. If Allah has ordered us, God has ordered us to do this, we cannot violate it. So we think that this is a short span of life. If there is a mother who cannot conceive, who cannot produce an egg, and there's a father, would be father, I mean, who cannot produce and for the same thing for mother would be mother. I'm talking about a wife, husband and wife, a couple, man and uh, woman, male and female. So when I call mother, she's a potential mother who's intended mother, but she doesn't have an egg. She cannot produce egg. She cannot. She doesn't have the capability of nourishing the embryo in her uterus. Or the man does not have the capability to produce sperms. And there may be other incapabilities, like there is some abnormality lying with the uterus, there is something wrong with the sperm production, sperm's health, and both of them, they can produce sperm and egg, but they cannot nourish the child in the uterus. So there is a chance to have a test tube baby, uh, and it is conditioned with the fact that sperm and egg should be coming from husband and wife. So this is okay. But as far as the surrogacy is concerned, involvement of third party, either they are donating sperms or eggs, and they are donating something to the couple, everything is unfair. So Islam is has prohibited this. And Islamic perspective is that this life is short. Many people are born, dwarf, they're born blind, they're born incapable of having a normal life. Some people are having genetic disorders, some, handicap, disability, impairment of some organ. So this is always there. So we believe that this is a short span of life, and one should be patient, and one should acquire patience as the order of Allah, and wait for another world where we would be facilitated and where we would be judged for our deeds. If we go for illicit child, if we don't go for legitimacy, and if we are having donation of sperms and eggs and third party involvement and surrogacy sort of things, so we are doing the sinful acts, and in next word on the doomsday we would be judged and asked for these deeds, and these sinful deeds would be repaid in the form of hell. So we are afraid, we are scared, that we don't want to violate Allah. This is the doctrine of Islamic principles.
I see your perspective is deeply rooted in the unwavering principles of Islam, which place immense value on the sanctity of lineage, inheritance, and the traditional family structure. Your concerns about the ethical and religious implications of surrogacy, especially the involvement of third parties, are quite compelling. I'm curious to hear more about how you reconcile these beliefs with the potential benefits that assisted reproductive technologies could offer infertile couples.
Yes, there are benefits that you can have a child and you can upbring and you can have a psychological dependence on that child. But again, surrogacy, once it is forbidden, it's forbidden. We don't go for, justifications and interrogations sometimes when this is the order of Allah. The way we have been given, orders that you cannot marry your sisters, you cannot marry your mothers, you cannot have incestual relationship, you cannot have incest in illicit relationship. But if you want to go into the details, Islam has a very strong principle of lineage and inheritance. So once the constitution of a child is doubtful and there's no proper definition uh, where the child has come from and what is the very constitution of the child, there is problem with inheritance and with the lineage of the succession plan of a family. So this is very important. Secondly, you see that if we talk about Western paradigm and the practices of surrogacy in West, you can find that there people are facing problems. Just think that in the type of surrogacy where sperm is being donated from somebody else. I know that there's a terminology like international surrogacy, where the mother or the sperm or the egg is taken from some other uh, person of an other international identity. Like I'm sitting in Pakistan, and in Pakistan, any couple is being donated by a sperm or egg from some Western country. So just see that if somebody is donating sperm or giving sperm or selling his sperm, so afterwards he can think, and or the lady who's donating egg, she can think about the constitution of the child, and this could be a psychological crisis for her or for him, that the child in fact constitutes the genetic makeup of that lady or that man. So you just see that once you're obsessed with this idea that this child has your chromosomes, this child has your genetic constitution, you can feel for that child, and you can think in another way that you are being utilized, and then there's another thing that that child can be exploited by the intended parents, one of them or both of them. In case that sperm and egg both are being donated by some third party, they can abuse that child, they can disown that child, and they can consequently eventually counsel themselves that the child does not belong to them, or any one of them, any one of the couple, its intended mother or intended father. If he or she disowns the child, there may be a big psychological issues for the child, and there may be issues for the couple. There may be issues for surrogate mother. Surrogate mother can be blackmailed. Even surrogate mother, who is the biological mother as well, she can feel for the child. There are a lot of psychological and legal issues coming from the psychological crisis, and the people who can suffer, everybody can suffer, everybody, every party in this constitution producing a baby by surrogacy, whether it is gestational surrogacy or it is uh, traditional surrogacy, the surrogate mother, the intended couple, the child, and the people who are giving donation of sperms and eggs, they all are at loss. They are all are at risk of having legal, psychological, and ethical issues. And this is very complex sort of thing. And Islam is very obvious and very clear in this stance. And Islam gives you patience. Islam talks about patience and talk about waiting for the next word. And Islam always promises that you would be rewarded for your patience. And if you are deprived of something by the nature, this is your test, and you would be tested for this deprivation. And if you remain patient and you're thankful to your God and Allah, you would be rewarded in the life after death, and you would be successful person on the doomsday. So this is the philosophy of Islam.
Your unwavering stance, grounded in the core tenets of Islam, presents a compelling perspective on the ethical and religious complexities surrounding surrogacy. The emphasis on lineage, inheritance, and the sanctity of the traditional family structure is quite thought-provoking. I'm particularly intrigued by your insights into the potential psychological and legal pitfalls that could arise from the involvement of third parties in the procreation process. Your call for patience, gratitude, and faith in the divine plan is a refreshing counterpoint to the often pragmatic approaches of the West. I'd be very interested to hear your thoughts on how these Islamic principles could be reconciled with the desire of infertile couples to have children of their own.
Yes, you're right. This is my stance, and this is not my stance. Basically, this is order of Allah. As far as few scholars are concerned, there are few Islamic scholars, and they talk about the justification of surrogacy in one way, that if the biological mother remains the same, the actual mother who is contributing her egg, and the husband is contributing his sperm. Both are normal as far as the production of sperms and eggs are concerned, but the female is not capable of nourishing the child and having the embryo and the growth of child within the uterus. So a few scholars say that if the intended mother has a real sister, and she's ready for it's not financial deal, but if she's ready on love and affection basis, and she is a mahram relationship, she can have that embryo in her uterus, and she can produce that child. And this is a very rare exception, but most of the scholars, they don't believe in such sort of practices. And this is a very unique example that few scholars talk about producing a child uh, in the uterus of the real sister of intended mother. So this is one of the examples. As far as test tube baby is concerned, there are a lot of you know deliberations of scholars, Islamic scholars, that test tube baby is okay. The sperm and egg come from the real husband and wife. Then there is a stem transplant. There is also an example that stem transplant is being advocated in Islamic perspective, and they say that it is all to correct the anomalies related to sperms and eggs. So stem transplant and stem cell transplant is again being passed or declared okay for Islamic couples, but it is all for the legally and religiously uh, married couples. Well, there should be limitations, there should be boundaries and checks and balances, and that is only order of Allah and God that keeps you within the boundaries and keeps you connected to what should be done and what not. So this is the whole philosophy of Islamic doctrine, and we don't believe in like we don't believe in homosexual marriages, we don't believe in lesbians relationships, and we don't believe same-sex marriages. Uh, that's that is simply we consider it a violation of Allah, and we don't think that divine things and divine books should be put aside, and the man should go ahead of all the obligations and principles and rules and regulations, and after violating the very divine things, he would be successful. He would not be successful. He would be judged in the life after death, and he would be punished for the sins he had been committing in this world in the name of progress, development, democracy, and scientific innovation and human rights.
I see your nuanced perspective on the rare exceptions and scholarly debates within Islamic jurisprudence regarding assisted reproductive technologies is quite fascinating. The emphasis on maintaining the sanctity of the traditional family structure and the unwavering adherence to divine commands is a compelling counterpoint to the more permissive approaches of the West. Your insights have certainly broadened my understanding of the intricate ethical and religious considerations at play.
So thank you very much. Thank you for interviewing me, and thank you for giving me the chance to express my ideas and representing Islamic principles, laws, and Islamic doctrine regarding the very controversial issue, surrogacy. Thank you very much.
I appreciate you taking the time to thoughtfully articulate the Islamic perspective on this complex issue. Your unwavering adherence to the principles of your faith has provided me with valuable insight into a worldview that differs significantly from the more permissive approaches often encountered in Western discourse. I'm grateful for the opportunity to engage with your nuanced and well-reasoned position.